Health psychology content, ways of treating substance misuse, drug treatment for heroin addiction. Blattler et al. Looked at the use of drug treatment with heroin addicts in order to see if it also worked to reduce cocaine use in those being treated for heroin. They found that such a program could be effective. Drug treatment involves prescribing heroin or a substitute such as methadone. Methadone is a synthetic opiate that blocks the effects of heroin and takes away withdrawal symptoms. The treatment is offered because someone can then give up heroin without withdrawal symptoms, which often are the reason that giving up is hard. The idea is that a heroin substitute is prescribed that has different properties but will help the individual not to take heroin. Such treatments are called maintenance programs because they are a way of controlling heroin addiction. Methadone is taken orally and stops withdrawal symptoms for about 24 hours, so a dose a day is required. If someone taking methadone takes heroin, they will not get the feeling of euphoria, and that helps them stop taking heroin. Methadone can create overdose problems, and also coming off methadone can give withdrawal symptoms. Buprenorphine is another drug that is used to help heroin addicts and is an alternative to methadone. It gives weaker opiate levels and is less likely to lead to overdose than methadone. There is also less physical dependence than with methadone. Evaluation strengths. There is evidence suggesting that maintenance programs work, for example, from Blattler et al. Wodak 2005 reviewed studies and found that individuals tended to continue with drug treatment programs more often than with other treatment programs. The National Institute of Health 1997 found that methadone maintenance treatment is effective in reducing heroin use and helps in lowering crime rates and reducing the spread of HIV/AIDS. Weaknesses. It is reported that 85% of patients stay on methadone for 12 months, and the treatment can last for 2 years, so there are cost implications. It is hard to evaluate the treatment, as it is not ethical to have a control group that does not get the treatment. Programs are highly regulated by the government, so running them is difficult.